Ona kusha kusha una kabo. Ona kusha kusha una kabo. Una welcome to the Bodi Beteh Gentri program. We na salon people don't learn boku book and they bring them to una. Okay. Me no to doctor. Me na me name Temu John Fuller. I'm the presenter of this program. Okay. Today, now it is second session, and today we talk about rabies. Okay. And today, Sunday the 26th of January, 2025, and Miss Nafisatu Sumaray now in the present. And when I get the whole Bodi Beteh Gentri team panel, we go there for answer any question when I get. The army family them if I ask question, we personalized, we're not able to answer them. Not to say now we don't want answer them or not sabi you. No. The reason we make the answer now because we not get to a medical background. Because some certain questions and they're not a general question. It could be say personalized to you. So we will need a little bit more information about you for us to provide that kind of answer. So we can advise it you take them offline. We get a Bodi Beteh Gentri group. I will share the link for anybody feel free for join. And if you join you can able contact one of the doctors them there and say, this is a problem, I'm a problem. If they're able to answer you, then go answer you. Okay. Yeah, so now general advice we give based on, if you see something within you foresee where you for get alarm, when you forget alarm, are you able, if there's something able sort out what you need for do that kind of thing. And also if you go see your doctor, if there's something for be alarmed by, you go see your doctor, waiting for ask, waiting at the question that you for ask, when you for raise the alarm, the kind of treatments then we for they expect the doctor for tell you, then kind of thing, and that general information we they give, we know they give personal information. Okay. And like I say about we already now we don't know they get paid. Okay. Then doctors they give them time for make sure say we self now we only to way this all they contribute to the Sierra Leonean society. What they say society or community, we just talk about overseas, we talk about especially with people in back home. The reason we could do in Krio, we need to try for insult anybody, but they try for do so that people, even the layman in a village, as long as they able to Krio, they able to know, they able to benefit from this information, know what thing they do, when for ask questions, who side for go seek advice, then kind of thing. They are with a big still, we still continue for appeal. So if anybody gets away for this program, reach people them wider and as alone by radio or TV, we happy for give the information free. The recording will not for charge anybody for them. We go get it for free. Not about for long make money. We do and for let people them able to benefit from what we do. Okay. Exactly they say before the program they get recorded and they go there on YouTube and Facebook. But also we get a WhatsApp number. If you contact our WhatsApp number, they they on normal contact. So only through WhatsApp you able contact we. And there's also an email. But if you want to contact me on anything, contact me on WhatsApp. Maybe you get a subject where you want let we deal with. Now they do it for so you get it absolutely right to ask. We say, dear, we discuss certain topic. We go look at that. Okay. But also if you get some question for ask. As long as, like I said, if it's not too personal, we will try to help you. If that's something okay, well, but if that's something we need you medical record and stuff like that, unfortunately, we will need that record for the able to provide that kind of advice. Okay. Not a consultation we provide, not just advice we try to give people. Okay. As I said before, if you want to ask question, some people in there will brave as me, then we want to show their face and ask question, while some people in there then go prefer for type. Like I say, if your environment noisy, or you're not good for public viewing, maybe you didn't have was place too hot, maybe pull it close and then kind of thing, and you are not come on video with the accent, you are like say by typing. And if you go on your screen, you this now normally you will see, but you will see a small dot now. If you click on that small dot, this page go appear. Okay, when you see this page, if you can use this for chat to it, send me messages then when you want, and not just like type on WhatsApp or type on Facebook. You can type and send you messages, whether you want to tell me, say, my voice not fine, or you want to tell me, say, you want to ask question directly for this session, or you want to make a suggestion for another session, please feel free for the one here. Okay, for the one that we brave like a me, we show their face, we get a lovely face like a me. Yes. You can press the air so for raise your hand, you can raise your hand virtually, and when I see you, I will come to you. But if you don't want to do that, you enable go through all that. There's not really all good party. You can just ace your hand up when you want to talk. Turn the video on, ace your hand up. When I see you, I will come to you. They are my family. If I don't see you quick, I'm not come to you quick. You know, miss I ignore. It just means maybe I don't see the content in the screen looking big. A lot of people linking this, so I'm able to see everybody on one page. Okay. And like I say, if you get any idea, suggestions, feedback, because we see now we are the best. There's always room for improvement. So if you feel say there's anything we can improve, get to with our email or reach to with our WhatsApp and tell me what you think. Apart from that, I will keep quiet now and I'll hand that over to the one we take on through the program today. And I thank you very much.
Pamela, good evening. Thank you for joining. For the end we know sabi me, my name is Nafisatu Sumaray. People know me by Nafi. Me na a nurse by background, but now I work in public health. So my job title na health protection practitioner, which means they for protect the health of the nation from infectious diseases and non-infectious environmental hazards. Also for help for promote health and prolong life. Next slide, please. So today I tell you about rabies. All you need to know about rabies, wetin na rabies. And wetin we dey cover today, I go talk to now wetin na rabies, the types of rabies, everything wey una dey see na this slide. Now we dey talk about today. I go tell you about the epidemiology of rabies. Then they talk about wetin dey cause the disease and how it is spread. We go talk about global statistics, wetin we know around the world about numbers. I go talk about Sierra Leone statistics as well, and I will talk about the challenges where we dey get na Sierra Leone for control rabies. I go tell you now wetin are the symptoms of rabies in people them, in humans them, as well as symptoms of rabies in dogs them. I go talk to una how rabies they transfer and how the rabies virus they behave inside the human body. I go tell una that. I go tell you about how to prevent rabies, wetin for do for wound care, where you get rabies, where dog bite you. I go tell you about post-exposure prophylaxis, which means vaccination where you forget after where dog don't bite you or any of the animal that win a rabid animal them. And we'll talk about wound care. Then I'll talk about global statistics, what in the WHO plan for end, rabies. And then when I'll get take-home message. And as part of the take-home message, I will play a short video for una for see as part of the take-home message. Next slide, please. So what in rabies? What do you know about rabies? Rabies na a vaccine preventable, zoonotic, viral disease where they affect the central nervous system. What in that they mean is that the virus, the disease na virus they cause them, and it come out from animal then to human, and the vaccine preventable. So vaccine the way they prevent them. But once person don't get rabies, it affects the nervous system, when are the brain and the spinal cord. You get two types of rabies. We get the furious rabies and paralytic rabies. Later on in the presentation, I will tell you now waiting at the difference between the two. Furious rabies na the most common one, type in human rabies. Where people get rabies now, furious one more now you see. But any of them two form, then either of them, they're all them fatal. If person get an 100% of the rabies cases, then go end up die. So now a very serious disease. The incubation period for rabies it range from several weeks to several months. From the time where the person they get the virus, they enter in body, to the time where they present the first symptoms, now we call incubation period, and they last for several weeks, sometimes several months. Rabies they affect mammal them, animals then like a dog, puss them, livestock animal like a goat, cow, pigs, wildlife then including the underwing monkey and bats. They all rabies they affect different kind of animals. Then. Next slide, please. So what do you know about the spread, the distribution of rabies? Up to 99% of human cases, that means to say the people where they get rabies. Now dog na responsible for that virus the way they transmit to human them. Although other animal and they with self can contract rabies, but dog 99% of case the way people and they get rabies now from dog then they get them. And rabies they affect domestic animal as well as wild animals, meaning animal they will get a horse as pets or they are within a bush. Rabies any of them can get rabies. It affect picking the way they between the ages of 5 to 14 and then the one they will more they affected by rabies. Other people, other age group then they affected, but picking them more. The reason being is that picking and they play more with dog them, and sometimes the dog will catch them, sometimes they go lick them, body will get wound. They know they go complain to them parents, say dog don't catch them or dog don't lick them wound. They not get the sense for doing. So now make them one group of people that really they affect by rabies. Rabies is a serious public health problem. It is over 150 countries them across the world, but mainly in Africa and Asia and Ademo Iboku because of poor communities, etc. I will tell you later on in the slide what to make Africa and Asia and then the one the way actually they get more cases. It present now all continents except the Antarctica Antarctica no more dey. I try for find information why e no dey there, but I look and say e go be say na because the animals dem wey dey cause rabies, the mammals dem, dey no dey in other parts of the continent. Rabies na a neglected tropical disease. E mean say dem country dem like Asia and African continent wey dem get am boku, much no dey in place in terms of resources, control programs, dem no dey, awareness raising no dey much. Sometimes wey people like dog can bet themselves, forget the vaccine sef, e tranga. So dem look and say na neglected disease because better program no dey for people and for let them the access if they need am. Next slide, please. So dog-mediated rabies, na im dem don eliminate, dem don pull am comot na some country dem. So country dem like Europe, Western Europe, Canada, America, Japan, and some Latin American country dem don pull comot rabies as a problem na dem country. Australia and other nations dem wey dey na the Pacific Ocean, dem sef dem don pull comot rabies, lolo to dog-mediated rabies. E means rabies wey na dog bet the person wey get am through dog bite or scratch, etc. Na im dem call dog-mediated rabies. That day dem don pull am comot na all dem countries yeah. But even though dem countries here wey dem no get am again, dem don pull am comot, dem can still get cases dem wey dey come wey na imported cases. It means sometimes people dem from dem country go visit countries dem wey na endemic country dem for rabies. Dog go bet there or other animal go catch them wey na rabid animal. Then count am na the country, so dem don import am. And when that can happen, it can cost the country boku money for actually look after them people and the way the dog or what the animal they don't go catch. And also for them able for keep them disease, then the surveillance, meaning that they keep an eye on the trend of them kind of case and the way they can get. And for keep them country free of the disease, they cost a lot of money. They also they look at transmission where they have in among wildlife animals, and then they all they cost them money for try for maintain the disease-free status and look after the imported cases the way they can at the country. Next slide, please. So when I've been beginning earlier on my slide, I'm telling you, I say now two types of rabies: the furious rabies and paralytic rabies. So this information on the left hand of the slide, now they tell you how furious rabies look like. When somebody gets rabies, they become hyperactive, they steady, they fat, you tell they don't, they restless, they make like a wooden way they can talk to the person, we don't go off. Then the person they get coordination, able to maintain a muscle coordination, they able maintain it. In a afraid water, the person can afraid water. If they get water for drink, he go afraid water. I go tell now later on in one of the slides then why make it go afraid water. The person they afraid fresh air, once for the outside air they meet them. And eventually the person can die. After a few days he can die. What can make it die? Now because he get either get cardiac arrest or he get respiratory arrest, which means his heart could stop for work or in lungs themselves could stop for work. That's not the furious one. The paralytic rabies, now the form of rabies, gets more, they behave like how the furious one they behave way the heart for, they steady all anything and they usually a longer cause, it take time, like gradually in symptoms and they come. Then finally, the person in muscle and they become affected and they paralyze slowly. The paralysis and the problem can begin at the site to side the dog bites the person, and they can begin at the wound site. Then gradually the person can develop coma, he can go unconscious, and then he can die. This form of rabies, this paralytic one, about 20% of rabies cases then now they happen when a paralytic one. And sometimes we can get what we call misdiagnosis because paralysis they occur in other different medical conditions. Then health professionals then can misdiagnose this paralytic rabies for other sickness then, where they make any country can sort of underreport the number of cases that they get because they don't misdiagnose them. Next slide, please. So this slide they show an example of somebody who get furious rabies. And so now they see dog bites the person in hand, or sometimes fox or any other rabid animal. This is a rabid animal where the animal where they bet you will give rabies, an animal where get rabies, not just all dog normal or all other rabid animal where get rabies inside. Now you go pass the virus. So you bet the person, then the person the virus don't travel go in brain, you see, where don't affect him brain don't inflame. If it get to this stage, the person don't get clinical symptoms. If they begin behave this way when I see so now, you see the person are all the so. And not paralyzed because you're able to sit up, but then get for all you see water they drip in mouth. So this now an example of a furious rabies. Next slide, please. So this slide, you see this pikin they don a paralytic rabies na im get. You dey see and say they don, they move, no nothing. We no go able know whether they move or not because not a video we dey see, but a muscle dey look waist. This person you don paralyze, and as I been on talk na my previous slide, it will eventually die after a few days. We don't reach a stage where you don't paralyze. Next slide, please. So what do we know in terms of global statistics across the world? What do we know about rabies? Up to 99% of rabies cases per mortal man dem. Now Africa and Asia na dey happen, as I been not talk before. And the reason why it boku na Africa and Asia, now side and way that they not get better program in place for control rabies. Then community the way poor rabies control program not they not get better access to vaccine them when rabies to dog bet the person better access not to vaccine, or either it be say they get small access or they not get at all. So all them countries so they really always get rabies cases in Asia and Africa. Dog-mediated rabies, when a dog they cause them, so dog bet the person you catch and I make it get them. They kill boku people then every year across the world. Over 59,000 people then they die every year from rabies. And 40% of them are picking them, as I've been on talk earlier on. Picking them are the most affected, And this rabies, it cause a lot of problem in terms of financial burden. It put economic burden on countries. Then it cost $8.6 billion per year because of the people the way they die, people the way they treat, etc. A lot of problems, livestock then they die, animal then they die. We get the country economic burden. They actually it a big problem. It a big problem. So $8.6 billion now the world they spend per rabies. Next slide, please. So that money there, that $8.6 billion, they now this slide don't explain so now. You don't shape almost to the go side. When they say 54% of that money they go from productivity losses due to premature death. People the way they die, obviously they work the way they do, the country they become affected economically because they already die. So now people the way they work sometimes and they serve the country. This then they get the economic burden 54% they go from people the way they die. And then you get 20% when a direct cost, where somebody gets the sick, the treatment when they get in a hospital before you finally die, all included under, as well as the vaccine they give a person get the dog better or the animal when other animal better. So this I know go all one by one, but this is not just a slide for show how that $8.6 billion they broken down for which to that level day. Next slide, please. So again, in terms of global statistics, as I've been saying, Asia and Africa are most affected. You see the whole of Africa. This red they show dog-mediated rabies. So rabies when a dog cause, I see all sign of Africa get them almost everywhere. Asia self get them. Then Salon, we get dog-mediated rabies. On this left side, they see Sierra Leone, where I highlight and they dog-mediated rabies then and Salon self. Next slide. So this they shows a problem all over the world. Like they over more than 150 countries. Then Africa and Asia are the more affected. Next slide, please. So this again another statistics where I see when different countries then but Salon also did this. So I highlight Salon you own them. You see saying different statistics in terms of how much people and die different years then. This year, I think we get 2 people in the struggle for saying because they look small. But I guess it's sometimes they say them properly, but it gets different the years and where we get more we die in 2016. We get 27 people and die from rabies in 2016. 27 people. And so now a problem as alone, 27 people have died from rabies in 2016. That's a big number. And as we don't say rabies, na very, very serious. It kill person. Once you get them, the person will end up losing life. Next slide, please. This again another statistics where I get rabies na Salon. The image na the left they show the different animals they would test for rabies, and 80 of them have been dog them, and the total of animal that we test positive, including dog and other one, they all have been 116. And then the slide na the right hand they show the human cases that will be positive for rabies. The red line then they show the estimates. They may say each year and 301 then they estimate. But when they do the test, Now, it not reach 301. This first year, and I also, I don't know which year, and there's also we're not going to see them because the come small na me, I know they see them better. The blue line, the blue dot, they shows the people that way positive, and the other slight green color they show the one that way negative. So 8 people have been positive this year. It look like 2015 and then this other year when I've been 2016, 27 people and positive when they have been not shown at the previous slide where they all died, 27 people. And then we get other years, then 2017 again we get some positive numbers then, and then 2019. So people are not dying as alone from rabies, where this statistic they show. Now one study where they been do where I get this epidemiological data from. Next slide, please. So this other slide they show the rabies. They show rabies na different district than as alone. Almost dog them push them and people away died. The dog and push away bets people and the other way died. Now 2018 and this data they been shown. So as on they see a bow tongue get boku number bow na get 403 dog bets the way up in there. And then get 3 people away die. Nabo, and then all the other districts then are in the list. So the other second highest na Bombali district, 147 people and been get dog bite or cat bite or then the third one way plenty. Now this one way na at Pujeun 107. Then get again 120. This na 129 na Western Urban area. But not all side die be happen. The side away die happen. Bo get 3 people away die. Bont get 1 person, and then Kaila will get 1 person way die. Koinadugu district safe. It look like they said get 1 person way die. So different district them then get a lot of bites, but bone have been the highest na saloon. So we know say a problem na saloon we dog then the best people and plenty. Next slide, please. So what are the challenges the way salon they face in terms of controlling rabies? We get lack of policies, laws they're not there where they make dog owners them become responsible. First time they say in the colonial days, policies them in the way the government put policies where people away get dog for make sure say they vaccinate them dog, people themselves they get rabies vaccine. But from when we get independence and say all land they don't come out. In those days, they mean get dog police the way they go make sure say the people they implement them, then go by waiting the government implement. But now we're not getting policies and they. We also lack of veterinary personnel. We not get better people away when people away there for look after animals them when they specialize in that field. We not get better. Can this na challenge? Then we not get the public not aware better about rabies, waiting at rabies, how serious it be. The public awareness in Opoku, better. We need to do a lot for raise awareness na the population as alone. Wildlife specialists, they will not get better. Then they, but they're not boku. When I've been read as he said and say, I don't know if not 2 or slightly over 2 will get na saloon, according to this study I read. Then we dog can bet person, then we not get follow-up measures in place where them put and say strict follow-up procedures for say we dog don't bet person, you don't get vaccine, then for follow-up for see what happen, the outcome of the individual, and if not dog we get rabies, the outcome of the dog. We not get anything in there. Then we get misconception about rabies. People the way when they treat rabies, they can tend for go to them, herbalist them, then they see say, oh, this rabies, yeah, this not for nothing. We person they behave so something which arm, then go prefer for go to native way. Then we get reliable data then on the amount of people where they die, from rabies when a rabies they cause them. So because of reliable data, it's difficult for get control measures in place. It's difficult for they get resources funding people where they fund because for let somebody assess and say this not a problem as well. You get forget reliable data for say people they die enough from this, people they get dog bites a lot. They say this not a problem for the way we put things in place. So reliable data not that much. Next slide, please. So what are the symptoms of rabies in human? When person get rabies, what did they see? The initial symptoms, the way they happen now, fever first, the person they get in body, they warm, they begin get fever. Then they get pain and something called paresthesia at the wound site. Women say the wound site they begin they feel like say the chuk like for saying I need to chuk am. Sometimes this if you know they feel there at all. I like it chuka, you know they feel them. They begin at the site where the dog better and they begin. Then as the virus they travel, they go to the nervous system, doing at the brain and spinal cord. When it reach the brain, it cause inflammation, and we get something called encephalitis they develop, which means inflammation of the brain. And when that they happen, the person they get difficulty in breathing. It afraid liquid, where I've been on talk before, hydrophobia. It afraid liquid and give water for drinking all one time because of the difficulty of swallowing. The person afraid for drink. And once the symptoms then don't reach that side, they die, they're not going to stop them. The person will eventually die, it will lose in life. So now make it very important for us to prevent rabies because it not gets medicine. If person gets rabies, it will eventually die. No matter how to do, it will eventually die. The only thing we go do for them, what then go do for the person, and for keep them comfortable until in term reach what they call palliative care. Keep them comfortable until in term reach. Sometimes if you get pain, then get pain medicine, but not for prevent them for die. The die will not go able to prevent them. The person will die. So now I make it very important to prevent rabies. We take them seriously. Because say this now a serious disease. Once you get them, you will get for loss your life. Next slide, please. If you develop symptoms of the rabies, you will get for loss your life. So this now another slide where they talk about more signs and symptoms of rabies. The first stage, waiting they happen there. When they see all na the diagram, then person can get headache, they get fever, loss of appetite. Then when you reach at the second stage, the person can become aggressive. And at the time they can turn and they can begin fed, then they afraid them light. They can get problem with eye here in foot. The person they get cramps in foot. Then the third stage now, it affecting eye them. The person you go to see where saliva they come on at the person mouth. The person can afraid water. This stage, third stage where you don't reach now, so I don't develop all the symptoms them. You can afraid water, like I've been talking. So this is just visually alone at the see the symptoms. Next slide, please. What are the symptoms of rabies in dogs? Where dog get rabies, now so they behave. They become very furious. You know, they afraid, they wild, the dog they wild. The way they back and sound, they change way they back. A muscle, then they become, so it gets something called uncoordinated muscle. You see where in back, you see how a muscle making in back. You know, for maintaining muscle balance. If they get boku pits, they come on in mouth. See the dog, boku pits, they come on in mouth. Then you know the afraid person. The dog not the afraid person. If na dog will be the afraid person before this time, you know the afraid person at all. And it can they behave the abnormal aggression. They see say the person, I like the dog, I like self person not provoke, nobody not do nothing, nobody not going away. Ingo just they go and bet people, they go bet maybe 2 or more people them, or they bet in company dog them, other animal them, in sound, in voice, they get different sound, way not a normal sound. And they behave different way when they expect them for behave, you know, during the day in behavior and net all different. Next slide, please. So how rabies they transfer? Rabies, human rabies, they transfer. Now the saliva, the pit of rabid animal, when a rabid animal, it means we already get rabies inside them. If he bites person or he scratch the person, it go transfer the virus through in pits, that in saliva, it will transfer and put on the wound. If you lick the wound self of somebody, not to just pass a bet and scratch. If you get wound, person get wound in a hand or any part of his body, if a dog will get rabies, lick that wound day. Or any broken skin where you get, or you taking your mouth, put on somebody in your mouth or nose, because I can see some people in the dog, they lick their body, lick their mouth. If that dog they get rabies, that is saliva, they go inside your mouth or any part by your wound, you self will get rabies. The virus will travel, go infect your body. So 99% of human cases then are from dog them. Bat themselves they cause, and bat and dog them where they cause 99% of cases are from bat and dog them. We don't know if evidence now they show say human to human rabies transfer. They extremely rare. If it is very, very rare, not common. But the advice to people where they look after a person who get rabies is if we be vigilant for take care, not for play with that person in saliva or in body fluid them, because if although they say they pass it very rare, but people for be careful, like health professionals or maybe even in family members, they say get involved in the care of the person, for be careful and not play with the saliva or the other body fluid the way the person they pass. And then if somebody do organ transplant, if the person get rabies, then taking rabies organ from the rabid person who get rabies, pass on to other person who not get rabies, that person they go get rabies. Now make then they discourage that not for happen at all. Anybody who get rabies, they not for transplant any of an organ to anybody because it can pass that way. Next slide, please. So what thing they happen? How the rabies virus they behave in the human body? And so now they see this diagram. The first thing where they happen, The virus they enter through dog bites or other animal they win a rabid animal. But because Africa na dog mediated rabid na common day, this example they show dog go bet the person number one, the better. Then number two, the virus they replicate. It means the virus they multiply. Now the sites inside the dog bets the person. And then it go continue for go through the nerves them. See then green, this green color and the nerve then they show so. The virus they actually move, they go to the nerve. Then it continue for replicate, it continue for multiply as they travel along this part of the, you see, now the nerve then, this now the back, so inside the nerve spinal cord. All here, so then get the spinal cord past there. So the virus they continue up here, so the way it is they multiply more. Then it travel now kind of the brain, it infect the brain of the person. Once it don't infect the brain, the person will get inflammation. Then the person will don't begin show clinical symptoms of the disease. At this stage, the person will in chance in order for live. Once you see you don't get it don't affect in brain and spinal cord. Very serious. Now the term that this way we say person we don't show clinical symptoms, and not go live. Then the virus now they continue, they travel now from the brain, they go to other organs, them they affect the kidneys, they go to the salivary glands, them it affects all side the person eye. Eventually now the person will die. So now so the virus they travel, they multiply, they go affect the brain and spinal cord. The person begin show symptoms, and we don't reach this stage now, the person will lost in life, not go live at all. Next slide, please. How will they diagnose rabies? Right now, WHO no get no approved diagnostic tool for detect rabies infection before the symptoms then begin. So if sometimes other tools than they, but WHO you know approve anyone, not doing a dentist, or they go say that this na WHO approved one. So for diagnose rabies na clinical diagnosis, it's difficult because if you not get test where they do with symptoms not day, it's difficult for them to diagnose a normal with clinical presentation without reliable history for say this person be not get contact with a rabid animal, dog don't bet am or dog don't catch am, or you see specific symptoms of this way they afraid water and way they afraid air, this hydrophobia and aerophobia. If then see they difficult for them diagnose the person. So now I make some country then they underreport the number because difficulty in they diagnose the person for other thing. Next slide, please. So treatment. As I been on the talk, once the person in rabies infection don't begin, you don't get the infection, you don't develop clinical symptoms, no effective treatment no day for the rabies. The person will eventually die. The people and the patient they always then can die, they can usually die. It will cause death. So now I make it very important that we prevent rabies because there's no treatment for it. Once the person don't get clinical symptoms where it don't affect his brain and spinal cord, it don't get encephalitis, it don't get inflammation of the brain, the person will eventually die. So the best thing now for prevent them, make no make reach that stage. The all man forget the vaccine. And the best thing than the people are holding a high risk side them. Next slide, please. So what we will do for prevent rabies? The first thing are vaccinating dogs. Dog vaccination. When you get your dog, you make sure so you vaccinate your dog for rabies, for the vaccinator against rabies. Now the cost-effective way than the strategy than they for prevent rabies, it reduce the spending, the money where people in they spend, that 8.6 billion what I mentioned. If you vaccinate dog them, you go reduce that one day, the risk to people and go reduce, then the economic burden that the country is able to reduce. The vaccination coverage of 70% is sufficient. If a dog then at the country, any country we're in a high-risk country, if 70% of dog then don't vaccinated, it help for prevent rabies in the country. It is stop. So if you stop transmission at the source, where before say the dog then at the source, then you don't stop transmission to people. If you raise awareness to the population, make the population know, let them aware of waiting at rabies, the dangers of rabies. Let adults and picking them know how dog they behave. If they know dog in behavior, they go no say this dog la no go near am, la no do this. If you prevent bites, animal where you not sabi, if you don't know the dog, you not sabi, I not sabi you, not try for go friendly to and begin play with them. Not try for feed the dog where you not sabi and not to your dog, you go bet you. So now really for do that thing and they all for prevent dog bites. What if you do where dog scratch you or where dog bet you? People and for know that. If you tell the population what and for do where dog bet them, where dog catch them, the awareness for day for say where dog don't bet me so you don't catch me, you don't lick me wound. I need for go do this. I need for go immediately seek medical attention. I need for go to the medical people and for let them give me the vaccination what I need. Then we for teach the people and responsible dog ownership. People where they own dog. Then for make sure say they train their dog well. Then provide food for their dog, clean water, Then make sure say then dog gets doctor ready for dog we go see him if he's sick. Find place for him for sleep and make sure say you vaccinate your dog. Now all landing in a responsible dog ownership. Owning a dog, it count with responsibilities. And if you make sure so you follow their responsibilities, then they for let you prevent rabies. Next slide, please. Again, vaccination, you get for vaccinate people then. We get something called pre-exposure vaccination. So you dey take the vaccine even when the dog no bet you. You know they wait for the dog bet you pre-exposure. So people are waiting a high risk occupation them, like people that already work in a lab, where they get for the deal with samples them, of people that already get rabies, you know, then they at risk for actually contract rabies because they deal with samples then from people then. People where they work require them for get direct contact with animals. Then people who they work at them vet side and they people who they work with animal, then they all need for get pre-exposure prophylaxis when are the vaccine them when they forget. And then if you dey travel for go na area where rabies plenty, or you dey live na area where rabies plenty, you suppose forget vaccine. You for make sure say them vaccinate you. You know for wait till the dog bet you forget as a pre-exposure vaccine. Next slide, please. Again, post-exposure prophylaxis now after wey the dog don't bet you, or the dog don't scratch you, or you don't get exposure to the dog whether na lick you or wetin, or any other animal when a rabid animal, you suppose forget post-exposure prophylaxis. Then call am post because already you don't come in contact with the rabid animal. So now na post now. So you get for make sure so you get that vaccine day for let you prevent the virus for enter you the nervous system when the brain and the spinal cord. You for seek medical attention as soon as possible where dog bet you or where other rabid animal bet you. Now, Salon, you can get rabies vaccine at EPI, where they call the expanded program on immunization. At EPI na New Englandville, now the people in the go for the rabies vaccine. And one thing I want everybody know is that if you don't get pre-exposure prophylaxis, it not mean say if you get dog bite or dog catch or any other rabid animal come in contact with you, he catch you or he lick you or put in saliva by you, sorry, you won't both. You know for take and say, oh, I did not get the pre-exposure vaccine. Okay, no. You for still go to the seek medical attention, let them assess you, and if you need the vaccine, they will give you because some people are not going to need the vaccine. But I will tell you now later on in this presentation, would I not need the vaccine. Next slide, please. So in terms of prevention, dog vaccination, as I've been talking, this is one way up on a Bona Salon 2024, we just go between 28th of May and 6th of June. Now both on a Salon. This organization, what they call Mission Rabies, you know, they work with Salon government and Jala University, then come together, then vaccinate about 4,936 dog them. Then say then ace the vaccine coverage up to 83%. This na both on this diagram one and this is on a both on so when they diagnose. I don't know why but I not be able to see the reason why, but as he say now both and do I don't know if now because maybe they get high because of one of the slides they were showing now they get high number of bites, dog bites and what a cat or what animal them. So then do an abo in between the 28th of May and June 6th, and then increase the coverage to 83%, which was good. Next slide, please. So this is not just information no more for people in a salon. I'll come across this. This is a Salon Animal Welfare Society. Now then contact this, then get a telephone number. Now down here where they talk say you know, then care for to your animal. They say then they give veterinary services, then they do pet care, then they do vet consultation. So if you get your dog, you want for let them look after her, you can contact me. I think say the office is somewhere in a Congo course. If me memory can serve me, but then get a contact number they way like the telephone number. This is not their website. This is not just for information number for salon people. Them say if you dey salon you want for help for your dog, probably contact them people are supposed for you for give you the right advice. Next slide, please. This is another dog vaccination way up in the Philippines. This is see everybody the queue, they bring the dog come for let them vaccinate them for prevent for let the dog know get rabies way insect no go pass on to human. Next slide, please. This na this schedule was shown now. So this na dog vaccination schedule where I see now one state in America what they call lower state. In America, I think different states then get different schedule. So the schedule where they get depend on which state where they. So this lower states then they give the vaccine to the dog around 12 weeks. Then they give the first vaccine around 12 weeks. Then any 1 to 3 years then they give a booster vaccine. Some state then they give between 12 to 14 weeks or 14 to 16 weeks. Then give the first vaccine of the puppy in life where they born them the first 12 weeks they get, and then after that, every 1 to 3 years, then they give them booster vaccine. In some countries, then every year, then they take up, depending on the law within the country. I've been looking for saloon, but I'm looking for see dog vaccination schedule for saloon. So I just show this one way, now one state in America. Next slide, please. So post-exposure prophylaxis, where you don't get the dog don't bet you or you don't catch you, what you do, we go to health professional. Then so now this slide they show this part. First of all, then they assess the wound and categorize the wound for see which kind of wound category this belong. This category of wound, you get category 1 where they up here when the dog just lick the pussy normal, but you no breaking skin at all. Then they don't need no vaccine. All you need for doing for just wash the side with soap and water. You don't. This section are category 2, where it break the skin, but you not bleed. You know they bleed. This category 2, and then they go assess and see whether the person get immunocompromised. We mean say the person in immunity low. You get low immunity, so in quick for catch disease. If the person immunocompromised, immediately then they get something we call rabies immunoglobulin. When antibodies to rabies, now so German them where they against rabies, when they pump inside body immediately for let them begin work for prevent that person then not develop the disease. In addition to that immunoglobulin, then they give the person rabies vaccine as well. So then go do the risk assessment for know waiting them forgive and when they forgive and how. If the person not immunocompromised, then they ask if you ever don't get vaccine before. If you not get the vaccine before, then they go get on the washing wound and make sure you get the vaccine immediately. But if the person be not get the vaccine within the last 3 months, then you don't need another vaccine now. If the vaccine you don't get it within the last 3 months, this is now for somebody who not immunocompromised or somebody who not get medical condition we making immunity don't handle. If you not get the vaccine, then they give you vaccine immediately. They not go give you the immunoglobulin because you not get immunocompromised situation. Your body they suffer from underlying condition where they make your immunity drop. They will just give the vaccine normal. Then this side, if the person get the vaccine in the last 3 months, okay, then they go cover them. Then they go cover them. If you get the vaccine in the last 3 months, then they go cover them. I don't need another vaccine. Then this category here, the category 3, where the wound really bad, the dog go don't bet the person, they go don't ripping skin off, sometimes saliva don't go inside, you go see something, the dog in saliva self, you go see and say evidence self na the inside the wound. This na category 3. So what thing we do the same thing they apply. If the person are immunocompromised somebody where immunity they don't, they go get the immunoglobulin plus the vaccine. If na person we no immunocompromised, na fit and well person, you not get no medical condition, but you not get the vaccine one day, then go ahead and get the vaccine, clean the wound and get the vaccine. But if you don't get the vaccine within the last 3 months, then no go get a vaccine again. You don't need them, then for just clean the wound. This part they talk about the animal we bet the person, then they ask about them. Now which kind of animal, na mammal or na rodent? Because rodents them like then agata them, not sabi them for cause rabies. But the mammals they want not talk about that push dog, bat them, then one and then they cause rabies. So one for no, then they ask information about the rabies, na stray dog or na dog when na pet dog, na dog we vaccinated. If na yes or no, most time you not gonna know the dog vaccinated, not to the dog. If the answer na no, then they go ahead and give the person the vaccine. So basically, this now for just guide the health professional in risk assessment for letting you know if the person need the vaccine and not, or if you need the immunoglobulin. Now, so then they decide. Next slide, please. Once they don't decide, they don't do the risk assessment and don't say, yes, this person is supposed to get the vaccine, this now the schedule where they give. If the person is never vaccinated, now patients will not ever get the vaccine before, if they get answer, they don't say rabies immunoglobulin on day 1, the very day where they bet them, then they give the day rabies immunoglobulin, then followed by the rabies vaccine. Then they give 2 for that 1 day. Then again, then they recommend tetanus vaccine as well, because some wound and then a tetanus prone wound. They see and say this wound is so bad of that because tetanus na vaccine within a soil. Where because then dog then they eat na gone, some dog then na gone, then we don't come in contact with the tetanus virus, so they don't they not safe, where you don't bet the person. Sometimes the wound says they infected safe after all the dog don't bet you don't. Tetanus virus can go inside and infect the wound. So I make them they say give the person once in tetanus vaccine for that day. You get in 2 doses of rabies vaccine, then you get 1 immunoglobulin vaccine. The immunoglobulin are just one of it they get. Then after 3 days, they get another 2 doses of rabies. Then after 7 days, they get back another 2 doses now. So this is 6 6 I they get for that during that 7 days period. If na person wey previously been don vaccinate am before, he go get on the first day, he go get 1 dose of the vaccine, and then after 3 days, he get another dose. Or they can do this one when at 4 sites, then they give them 4 for the first day, then they give them the tetanus vaccine, then that's it. So the health professional will decide, which one they will give the person, which one appropriate for, and where you don't do in assessment done. Next slide, please. Wetin na the care wey for do for the wound wey dog bet you, or a dog bet you, a scratch you, don't wound the body, or you just put in pit by you normal. What if for do if for wash the place good one, for let it pull the dog in saliva comot, let it reduce the virus, because the virus they na the dog in pit wey don't put by you. So the way you wash am so under running water, if you no even forget running water, somebody go pour water. But wash am with soap and water for 15 minutes under running water for make it reduce that virus they come on at the side. It dey really help. Then they say health professional then for avoid for stitch the wound that moment, then for delay the stitching of the wound, for allow the vaccine where they get for give the person or the immunoglobulin, let it travel, go na the tissues and fine. So now make them for avoid for sew am or for delay for stitch am. And not cover the wound tightly, not cover am tightly with dressing and bandage, left and loose. So now that's it for then immediately for seek help. Next slide, please. So this na WHO strategy where WHO get something in strategy we call 0 by 30. So WHO wants by 2030 for let the whole world eliminate rabies by 2030. Let them pull and come out as public health problem. Let countries then where Asia and Africa we know say na the main one, then now na they boku. Make them self get 0 by 30. Let them not get no rabies cases. Then we then go say people are not die of rabies. And the strategy that then so them call 0 by 30. So the world work towards achieving 0 by 30. By 2030, they for don't eliminate rabies come out na the whole world. Next slide, please. And how WHO want take do this? So this not the plan. I not go through all of this now, so but then get the objectives, objective 1, objective 2, and 3, where then they try for maintain across the globe by 2030. So on this slide, then I mean the right side, and get a phase approach for eliminate rabies by 2030. So they may not begin the startup phase between 2018 and 2020. Now 29 countries and them enjoying. They make sure say they provide for them services in play, then give them programs them for make them go reduce rabies, then give them resources and for let them do the mass dog vaccination, then they raise awareness in people, them, the public, etc. So we don't move from this phase now. This phase now they don't come to the next phase when at the scale up phase between 2021 and 2025. Now this they continue. They don't add 52 more countries them now the scale up phase. And waiting they don't learn from waiting they learn now so that the startup phase, then we implement and at the scale up phase now for let them improve the strategy and the policies they would don't put in place. All in country also for pull come out rabies by 2030. And then between 2026 and 2030, then we'll go to the mop-up phase where they will add 19 other countries and at this phase for make them then provide for them everything where they don't provide for the startup phase, the scale-up phase, and by the mop-up phase, all the countries. Then so about 100 countries then they try for target for make sure so they pull rabies come out as a public health problem by 2030. Next slide, please. So that global strategy day, that phase return, that phase approach day, now the money this way they incur on the phase approach. So the startup phase, they know incur $16.5 million now it will cost the world. It cost the world for get this startup phase, and then it don't already cost them because they don't pass that phase there. Now then at this phase 21.1 million and then get for spend now, and yeah they will spend 12.1 million, and the total money by the time they will come to zero human deaths, it go don't cost $49.7 million. Then they expect for spend by all this phase here for achieve 0 by 30. Next slide, please. So what I take on message. So this slide they show everything what I don't tell now. So the virus, how the virus they transmit. Now the saliva of infected person. 99% of cases then dog-mediated cases then are from dog. Human cases are from dog. The virus will attack the brain is fatal. It cause death. The person will go for die. Treatment no day. And what you go do in terms of treatment, I will just wash the wound and access immediate post-exposure vaccination if you don't get dog bite or scratch from dog or any other rabid animal. And how for prevent rabies from transmission from dog. Now when you do mass dog vaccination, you avoid for let dog not bet you, raise public awareness, make let people aware. And this now the global statistics where I've been talking about Asia and Africa and I'm more affected. And 40% of the people that were affected now picking them. And they say every 9 minutes, one person they die of rabies in a country. Yeah, so we in endemic countries then. And obviously vaccination is 100% preventable. If they prevent rabies, 100%. 70% of dog them, if they vaccinate them at the country, then we don't help for make rabies not go be problem in that country. Dey. And everybody when a dog owner for be concerned and for make sure say they practice responsible dog ownership. Next slide, please. So the next slide now, a video now they can look about a short video about um more information about rabies. Basically, a take home message of which I don't tell now.
Welcome to Sumaray. This is Ryan, and that's that punk. Ryan has been a street dog as well as a pet. Most important thing about Ryan is that he's vaccinated against virus. We're talking about again. What's the most important thing that we should remember about rabies? Have vaccines for animals and for humans. Vaccines. Diseases. What happens to other viruses and most bites of dogs and actually other mammals. But other mammals infected. A whole lot about how we can bites, animal bites. Animals, oh, petting animals, oh, which is happy. You understand what that was to language actually was. And this points it out expert. It's actually unbind. I would buy a dog. One of a dog that had about that, right? And after I received I asked, how have vaccines changed since then? Vaccine, that is another vaccine. Vaccine. Against developing, as I said, finding parts. That's what that's and if you're a pet owner or if you're around the street, to remember vaccinate dogs and the animals you can, and then such as you can. 6,000 presents. And our animals, most of them, so prevent bites. So, until next time, stay healthy and stick with science.
TJ?
Yes.
That video in...
I will try for sort about and see if I can play them back later.
Yeah, that's I think. Sorry, apologies everyone. The video, the sound quality wasn't very good there. When I sorry for that video day. We don't know what's happening. I think TJ is trying to sort it out.
Yeah, continue more with your presentation. Because at the end and the if you don't let the people know, I will try for see if the video will be played back before finish today.
Yeah, that's not the end of the presentation, but the video will not play, so you really get useful information. When a summary of everything I don't tell when anyway. It was nice if TJ able for sort out, then we play them back for everybody see. But while TJ they do that, if anybody gets any questions, you know, when I can ask the questions and we go take them from there. Thank you everybody. Thank you for listening. And apologies about the sound issue there.
No, plenty, thank you. I'll share the link to the video in the chat. I will try for sort about now, but I don't know how to do that in a while. I take questions at the same time. This just shows no more. Say no matter how much you prepare, sometimes things go wrong. But I'll try to figure them out on the side. I not can normally present on Zoom where they use video, so I think I don't change the settings on your side, so I will need for undo them. But on a plenty, thank you. At least when I've done patient, when I stay on and listen, even though some of them are not able to hear exactly what they go on. I can see the link in the chat. I would also try for put them in the WhatsApp group for anybody we miss them. Then we will watch them later. We don't hear waiting Miss Nafisatu Sumaray for say about rabies. You don't explain to we waiting at rabies and how we get them and some of the home care we self can take should in case something goes wrong, you know, something happen at us, which we will do on the immediate effect. But also if you know they want the really within areas them, especially Freetown, we services them there, you know, where you able access, when for access the services them there, and how you can reach the services them there. Now for the one that we know more than we are happy for them put their hand up. For enlightening people, outside in cable get extra support. Say, for example, maybe waiting we don't see, maybe some of the information may be incorrect, or maybe there's additional places them they where people they can seek help or additional advice. Please feel free for share them in the chat, or maybe put your hand up, and I will come to you. Let you share that information with other people. The reason why I'm saying this is because we try as best as we can or source the best information we will, but unfortunately, something they can be difficult because as you understand, statistics, not alone, but especially Africa as well, it can be difficult. And anti-Nafi stress on that there as well for say, you know, for them able to understand exactly how bad this issue be, or even certain health issues that we could look at. We get for able to get good statistics. Statistics that we will able to rely on. So the statistics that we'll get, we didn't say you know daily, but we don't know how reliable the statistics is. Then statistics then they be. You know, for people who understand statistics, their numbers them how reliable them be. That will be able to guarantee. Because for let they able to provide the help, support, and guidance and stuff, we can forget numbers, how regular this thing they happen. You know, in what areas them this thing they happen. You know, if that's until we like certain age group the number they affect, all that kind of thing. When they get all the numbers and they then be able to decide, say, okay, Lord, go ask for help. But if you go meet somebody now for help, for say, I need help for something, and you don't get numbers for back waiting you they say, you know, also maybe they forgive you, say, for example, $100,000, then go look and say, this your situation not serious, $10,000 enough, or maybe they go say, no, your situation not serious enough. Don't focus that resource, that money to other areas, other countries, them way the situation was, you know, because they get numbers the way they show say their own country the situation was, when really maybe in reality your own country, your own bad self past the other person. I hope that makes sense out of all this. So now we open the floor for any questions where anybody gets. We're happy for taking any questions. I'll look at the chat if anybody gets any question. Don't tell me say and Auntie Nafi explain this thing so well that nobody not get any question. But one of the questions we me go ask Auntie Nafi.
Yeah.
I know say some of the information where you don't pass now, which you get, and you don't explain to me the home remedies and stuff. But now, if somebody gets this, let's say the person don't get the rabies now, you know, you don't pass the prevention stage, they don't get the rabies, and they look after an house. They look after an house. I know so you explain about how people have avoid for the pit of the person, not touch them, and open wounds and things like that. One question I want to ask now is, you got advice say for people and we not understand how to deal with this thing. You got advice say for them deal with an house, or you got advice say for it better let them carry that person they go hospital. Because what I look at is people and they will get less information than me and you. So for deal with them people also not something it can pose a risk where they might pass on to somebody else. So which thing would be your advice? Given that, like you say, information for this not bokunato. Not like before we been get, I remember we been get dog police, we been small. We get dog police, we come around and catch them stray dogs and stuff. Now I need to see that they happen again. So what thing would be your advice? You got advice say because of the person sick now, then look after our house, or let them go hospital. They not feel say they not get the right information, which you got advice.
Thank you for your question. I don't know if you remember when I did talk about one of the slides, I talk say person for seek medical help immediately when dog bites you. So you go seek medical help, they will give you the post-exposure prophylaxis vaccine. But in the event that you don't seek medical help, you go on a house, you develop sick, you fall in a hospital, not on a house. Because first of all, when the thing they happen, I will be surprised if they diagnose the person, say they suspect say he gets rabies and they left and go in a house. I will be very surprised because then case in the hospital and for day. Although yes, we know say the person will lose in life, but one of my slides that talks say you need palliative care, which means that care then a care for keep and comfortable till loss in life because you will get for eventually die. You know, now make for prevent them. So you know for then if you didn't OC risky because as I say, we not see human to human transfer. It's extremely rare, but the research they advise say make people then be careful. People who they look after patients with rabies. So if you're in a home environment, the chances, the likelihood for say you will come in contact with the person body fluids is great because you know get gloves in house, you know get apron in house for look after that person. So the best advice would be let the person in a hospital. I know say it's difficult for get people in hospital sometimes and because of the misconception where the family go don't get say this not for nothing, then go take and go to herbalist them for women them, which the risk they spread by that because that herbalist when they go, you know, they look at the rabies point of view, in they look and say now other black magic or whatever. Then as a result, you know go take precautions for look after not for touch the body fluid them. So the best advice would be the person for the hospital. I hope that answers. If anybody get anything for add to Dandy from the Well Body group, wanna feel free for add. Thank you.
Yeah, thank you very much. Yeah, that answered the question. Now, Dr. Bell, so I can put you on the spot again. The reason why I can always ask this question now because when it comes to Bella, for example, people women that were pregnant, is that then they carry another life. In their own case, if say Beloma gets to this stage, is there anything they will can do for the pikin, and at what stage they can able do anything for the pikin? You able help you on this? Or anybody within the panel, the doctors them. Yeah,
good
sorry.
evening. Good evening. Yeah, well, first of all, I go like for make I think we get experts there in the guests them where they watch right now, we can tell we more about the situation at Salon. And I think it's very important for make them then get say a few words before I comment on that. Yeah, make the one. I don't know if it's still I don't he be introduce himself.
Yeah, now
We
Mr.
start.
Godush Jallo. Mr.
Yeah,
Jallo.
please, look at time. They say a few words about the situation at Salon and the work with them do up to now. We thank
Mr.
you
Jallo,
for what you did.
I try for unmute you. Godush? Mr. Godush Jallo.
Oh,
Yes. Yeah. No, you don't mute yourself back. Try again.
Joseph.
There you go. Hello, sir.
Yes, hello?
Yeah, how are
How are
you?
you?
Welcome. Yeah, welcome, sir.
Hello?
Yeah, you didn't say
You gonna
hold
get
on to
me?
some.
Yes,
Yes, how
yes.
are you?
God, this is challenging. Because
Good to hear
really,
you.
rabies is, yeah, okay. We need to understand. From my experience for more than 30 years with reference to rabies in Sierra Leone, and also when people then don't get in contact with a rabies dog, most of the cases where they get, if not also, then some of them, then they easily kill the dog and they can take the person in the hospital. And wherever there is a rabies case, most of them is not treated really at home because the home medicine, they solve that in there. And once you are down with rabies, about 99% of victims of rabies with clinical signs goes down, they hardly survive. If you will survive, you have no life after that, So when dog bed passing, the hospital, most of the cases where we don't witness, and I don't witness plenty cases where there is direct human bite, and I don't cases where people really they go down with signs and symptoms of rabies. So we therefore really look at very critically when we talk about rabies infection in human beings and also in animals. In animals, just like one of the animals, we get all the presentation, you get the dorm and the feral stage of the rabies. Also, again, sometimes when there are rabies cases, we need to know the circumstance of bite, what it makes it in dog. Because not all dog bites are rabies dogs, So we need, we need really to address this thing in more technically and more professionally somehow, or see what is the situation that really take place when there are dog bites, and especially in Sierra Leone. And for rabies in Sierra Leone, I don't know if anybody don't work on rabies like me in Sierra Leone, because we started from 1988 with the work on them, and up to that we get even the One Health we take our up now. We've been working with the World Animal Protection, Humane Society, and so with rabies, we don't vaccinate so many dogs. And also, without those cases, all human cases, they refer to we. So that's our situation. So we need to look at this and kill cautiously and kill it so people they understand what didn't happen when dog don't bite somebody. So in short, I hope that we will get more time for interact more on this. For me, this group and the pioneers of this group here, allow talk more, allow see more how we go talk about the issues, So in short, that's all. There are more things we can only discuss and talk about it. Thank you.
Thank you very much, sir. You make a point there, say, not to all dog bites, now rabies bite. They look at them from also anti-nafibi they come from say better for prevent than for cure. Wherein if you get dog bites, it advisable. I don't know what you think though, given that now you did it, now you're the experts, now you don't get the experience,
Yes.
you understand? Yeah, I don't know what now you take on that.
When there is a dog bite, for the fact that so whether this dog is vaccinated or not, yes, it's the prophylaxis. That dog need to be if possible, captured and isolated for at least for up to 10 days. Then the first way the dog bite, it can start taking vaccine. If after 10 days this dog not die, it is assumed that at the time of bite, this dog was not rabid. So that's the case. But always, since you don't know the state of the case of the dog, whether it was vaccinated or not, you get to handle it with caution. So that is it. Normally when they come to me, I say, okay, you don't know the dog vaccinated? You don't know. What you get? You don't know. So we say, okay, start take the vaccine and let's observe the dog. But in most cases, again, when there is a dog bite, whether it is rabid or not, the tendency now to kill the dog. And when you kill the dog, you don't obstruct diagnosis, straight, you know. And with that, you don't know whether the dog was rabid or not. So they say, okay, well, if the dog don't die, I continue with the vaccine, the full dose vaccine. Since you are not so, you know. So that is the situation. And sometimes the dogs, you know, be able to catch up for observance. So those are the things. So whenever there is a suspected or there is an actual dog bite, for whatever reason, because normally, as I say, the circumstance of bite. Why do dog bites? One, if the dog is hungry, go attack another. If they defend himself, also they protect himself, or they defend an owner, they protect the property. These are some of the cases why the dog they bite. Some are cases, yes, because they are rabid, yes, they can bite. Those are the, but whenever there is a dog bite, there is a need to know the circumstance of bite. Why did this dog bite? You know, those are the first thing you know. If you know the circumstance, that will even aid you in the diagnosis and also in the treatment of the individual. So that's about it.
Yeah,
Thank
Auntie
you.
Nafi. Thank you very much, sir. Auntie Nafi.
Yes, I just want to thank Mr. Jallo, and I want to agree with him with it talk. One of my slides they want to show, I know if you remember, also I talk about the wound assessment category 1, 2, and 3, and I said the left side they talk about the animal. All waiting talks to them will ask you if the dog don't die now 10 days ago, etc. You look for 10 days. So yes, the assessment not just on the individual, but as, the dog as well. Like you want to know about the animal we bet. Now stray dog or a dog when a pet, etc. So yes, thank you, Mr. Jallo.
Okay.
Well, sorry for coming. You know, in our context, when you know, when do you call the dog a stray dog? You have to understand. Sometimes a community dog is not a stray dog even, because they live somewhere with somebody due to irresponsible pet ownership. So the dog they waka. It may not be stray. Somebody's feeding it within the community. Sometimes not even a stray dog. However, if it's not vaccinated, you get the risk of having rabies. So we get this. We here we don't vaccinate tens and hundreds of thousands of dogs for against rabies. We don't beside the clinical idea, we take sample of blood for send abroad for know the title of dogs and whether they are rabid or not. There are many things that can be done really for address this thing at community level. But as I say, I'm happy with this group. Maybe we can work more together. You know, but we don't do a lot of work. If you just Google my name, you will see that if you Google Gudus Jallo, you will see a lot of work we have done. So I'm more than happy to work with you and to be part of this group.
Thank you very much. I will share our number with you. Let we touch base on WhatsApp or by email, and then we will take them up from there, because it seems like there's a lot of work the way they do. We are good work, and it will be fine as well for we coordinate, and collaborating, for future efforts. One of the questions I want to ask, given that they do so, such a stallion job, salon. What I want to ask is, how is the statistics when they collect? How, because I understand say Freetown will be better than most of the provinces, but what they do now the provinces and stuff for collect all them data, as in dog bites, the type of dog bite, whether they're rabies or non-rabies, that kind of thing. When they collect on Freetown, how well done they be, but also when it comes to the provinces, how far and wide are they collecting statistics here? And if one gets access to that, that's until they public, or that's until we get for reach out to anybody say one get access to that kind of record. That's until they need, they public, or that's until they get for reach out to a certain organization.
Well, for now, the thing don't improve. There are surveillance, there are reports of dog bites, whether now for whatever reason reported in hospitals. These have been collected and sent to the Minister of Health and the One Health. If you contact the One Health people, they will be able to tell you really the status of dog bite in different districts as reported and the actual cases of human cases. So they'll be able to tell you. Contact the One Health team and they will be able to tell you over a period.
Okay.
I think there are those data now that is being recorded. Yeah, yeah, by district, by district, by district, yes. And there are
That's,
those information now, yeah.
thank
So
you very
well,
much.
as we keep working, we can get more. Well, let's see how we can work together. Let me see really putting on the aims and objective. What do you do and what do you want to do? Who are these pioneers? What, yeah, interest? Let's talk. When I know I can advise you better, we can work together a bit.
Yes,
On that,
that'll be brilliant.
yeah.
That'll be brilliant, definitely. One of the questions that we did at the chat at the moment, these now to Auntie Nafi or anybody within the panel, we get information on this. Somebody gonna ask say if somebody can still be a carrier of rabies if they don't treat them, say maybe 2 years ago. Somebody can still, that's where they get cured, if they treat them, it go completely, or is there a chance that it will retain some of any trait or anything like that?
I can help with that. First
Yeah,
of all,
definitely.
I don't know at all. When I'm in a presenter, I tell when I say once the person don't show clinical symptoms of rabies, they not get medicine.
Yes.
So that means to say that person they go eventually die. And when somebody don't die, we're not go talk again for say if you remain in the system.
Okay. So, what about in cases where the person don't get maybe the dog will bet them, in this case now the dog get rabies, then give them the post injection. Is there a chance is there any chance it will still get them, or once they don't get that injection day, that's it, or they get for come back for another test again sometime down the line, for them to make sure say yes, totally they don't they don't get rid of stuff. I don't know.
I'm gonna let Mr. Jallo kind side, but what you know is the timing very crucial, very important when dog bet you. In fact, if that they want them for begin give you the vaccine. They want.
Okay.
Yes.
Okay,
Mr. Jallo, you
let
go
me
carry
just
side
come in.
talk more.
Yeah.
You know what they do.
When there's a dog bite, what do they consider? They consider the location. Where did the dog bite? What part of the body? The virulency of the virus. Those are two key things that we they consider. Now, depending on how I bite, sometimes this thing can take 1 month, 3 months before they get to the brain. Depending on the site of bite. Some places, like say up to the neck, now instant business. So sometimes those are vaccines will not help. Now immunoglobulins, they help. If we come to the hand, to the foot, yes, it can take some time, nearly 2-3 months before you go reach to the head. So that when they get, then yes, when you get as I say, if you don't with the signs and symptoms don't come, no way, you don't bother about it, but there's no treatment for it. So that's about it. We don't bite you, you don't do that. So for say the infection, no, once there is sign and symptom, to think about again, who side they come again. So basically that's it. It's similar to the animal themselves. It's also sign and symptom. You cannot think of really who side go come back or whether I go well or not. The vaccines, yes. But just remember the vaccines, it is a virus, it has no treatment. That's not we all understand, say, virus, they not get treatment. So the prophylaxis, we don't take away, don't bite immediately, you try for, make sure, say, you don't cut across the virus for like no reach to side for go down at the essence of the vaccine and immunoglobulins. And most often that there are no immunoglobulins, especially in the case of very few cases of immunoglobulins. So basically that is the vaccine. Yes, if you take them early, you'll be protected from that particular thing there, so and fit your bites. Those about it. Hope that answer your question.
Yes, that's a good question. Thank you very much,
Mr.
sir.
Jallo, una get immunoglobulin available in salon?
No.
Well, really, I cannot. It is a yes or no, but it is not common if it is there even.
No,
Okay.
not there.
Okay. Thank you.
But the vaccine can be available sometimes. Sometimes again, as somebody been they talk about traditional medicine and so forth, and there are some funny myths about rabies from community. Sometimes, you know, they feel so it's demonic. It's not demonic. So basically, so because of them kind of thinking sometimes, of course, then changes that they are more change better understanding now. Because of them thinking, then there are some, as you rightly somebody was saying, traditional healers. Yes, those are there. So, but I mean, that's not for the rabies, really. Yeah.
Thank you.
Okay, thank you
Okay.
very much. Thank you very much, Mr. Jallo. Is there any more questions? Because we don't really run out of time.
I just want to say one thing where somebody be ask me, say when somebody eats animal, when a rabid animal, if they get rabies from that. So I've been going to do a bit of research where I find out, say, they say no scientific evidence, no, they say when you eat animal, we get rabies, you will get rabies. But then they discourage them 100%, not for eat animal, where you know for say this is a rabid animal, not for eat them. Although research not sure
Yeah.
and say you get them from the animal in beef or in blood or in milk, you know, but then they discourage people then for eat animal. If you know say
Yeah.
this animal get rabies, no eat them.
Okay.
So
I mean,
that's
I
how
can
you
come.
find out, just to make a share.
Okay, let me just give input on that.
Yeah.
Generally, the issue is the preparation, you know, and rabies virus is always in the saliva.
Mhm.
So it must have a leak or a bite or get into an open wound. The meat itself, I don't feel say the meat itself get rabies. Now the head, from there, from pituitary gland, they release the saliva, and when that saliva, the infected one, if you touch them, then you go in the process of preparation. That rabies virus itself, the free heat, the very small heat, they kill them. So I don't feel that even cooking will kill the virus. But you know, there are no, as rightly say, there are no evidence eating animal from a rabid animal will give rabies. But you know they say. I know they go it raw. In blood, no, the virus, no, in the blood, and there, you know, so those are the cases, the way it works with rabies. So if you go eat, no, don't eat it. Once, I mean, generally we say, forget about animal death or whatever it is, forget about it, don't eat it. But yeah, that's about it.
Thank you.
Thank you very much, sir.
Okay, thank you.
Coming back to the pregnant women, I mean, if the pregnant women get bitten by a rabid dog or by a dog where forget the vaccine or get the hemoglobin, they say you can't treat the woman as well, the pregnant woman. You know, there's no difference between the pregnant woman and a non-pregnant woman. And if the woman, and there's rarely cases where pregnant woman gets rabies. They just show, just where they scroll the internet, they show one case 2016 where they say one newborn baby survive where the woman gets rabies. But apart from that, there are no cases that shown that women where then they during the delivery get rabies. Only that one case, or the one or two cases, I know in the whole world where they record. But concerning the vaccine, concerning the hemoglobin, the pregnant women have supposed to forget them if dog bet them, and then concern about rabies, then they can get the vaccine, they can get the hemoglobin.
Yep. Thank you very much, Dr. Bell. Antina, if you want to add anything more
No, I just
before
they say message then at the chat where Bambi put say some people and then they seek medical help where dog bet them, but then they always blame and say na witchcraft, which is true. Mr. Jalo self talker.
just said yes,
They
just
get
talk.
a meat, yes. Thank you.
Yeah, that's the reason. And I make a touch on that. I see the message, but where Mr. Jallo touch on that, I just decided not to make a comment. Okay, the family I really don't do well for staying with me this long. We really don't pass time. I will go around the team quick. They allow make them as short as possible, and I'll send the people and go home. Dr. Bell, I just talked to you.
Yes, tell I think you want to join today. This now was a very important topic, especially for Sub-Saharan Africa and for Asia. And please, if you know people we want for hear this message here, so please send the YouTube video to them when we upload them, because it's very important. Say more people then can they watch the YouTube videos than they live. So please send them to people them. Mr. can do me best for send them to people them, because we know so everybody Beteh pass Gentri.
Thank you very much, Dr. Bell. Isata?
Yes, CJ. To be honest, I don't really get anything for add more than waiting Nafi don't go through and all the other inputs them would all get. So I would just repeat myself. Always I would say is, let people really take the information where they don't listen to very seriously, and now they equip. So if anything happen, they get an idea of what to do. They get an idea of what to look for. So if we not forget anything, because I know say some of the information is technical and a lot of information. When I listen to the video, then when I make sure say when I apply everything when I do. Yeah. So when I thank you very much for our audience. Well, Bodi Beteh pass Gentri. Thank you.
Thank you very much, Dr. Ture.
Yeah, thank you so much, everyone. I think somebody named Kiro, I thought Kiro want to say something. Yeah, time for say.
Okay,
I thought Kiro, you can unmute yourself and say what you want to say.
Mr. Kiro is still on.
Okay, well, I don't know if you're there, but anyway, before Kiro come in, I want to say thank you, Nafi, and thank you, Mr. Jallo, for your contribution. At least this he hardly then talk about rabies, so we don't talk about her now. So
1 minute, Mr. Kiro.
Nothing they follow we add.
Yes, but you want to say something.
Yeah, go on, Mr. Kiro.
I think Mr. Kiro they talk.
Mr. Kiro? Dr. Ture, continue.
Yeah, so nothing much really for
yes, Mr. Kiro, I've been the work with Dr. Jallo.
Yeah.
I've been the president of the Sierra Leone Animal Welfare Society. Yes, please.
Yeah, go on,
Mr.
Kiro.
Kiro from Freetown. I've been the work with Dr. Jallo.
Okay.
Yes. Yes, I've been the president of Sierra Leone Animal Welfare Society from 1997 to 2004. But then, I've been the emotional side, Dr. Jallo, I've been the emotional side and also the write the project paper. Then why is Dr. Jallo and I've been the technical person specialist where they pursue the technical aspect. The emotional side of things was that, the relationship between the dog and the family of Pekin, up to 14 years of parents of the Pekin or the household where the dog they bet. Then there is together amicable relationship. Somehow the dog became rabid because sometimes now the environment one stray dog can bet them and something like that. Unbeknown to the Pekin, whether it's to play with the dog or the parents, then at that emotional side they keep the dog company, enjoy the friendship between the dog and the human being. Then suddenly they expect the dog for turn enemy for attack them because the dog they're under the influence of the rabies virus. So you see the dog pikin one play the dog they attack him bet. Or the parents will not understand when they defend the pikin, then the dog bet them. You see that side was so emotional, so that when we get involved in this program, we try for make sure say Dr. Jallo can get the funding, and we do about 2 or 3 campaigns at Freetown. We do na Freetown East, we do na Freetown West, we do na Freetown Central. And then also you will find out, say, when the dog bet the pikin, that's a medical issue now, that's a Ministry of Health, that then get a problem there. But then for men, the dog itself, that's a Ministry of Agriculture problem, because now the veterinary section of the ministry, of the veterinary section, or rather the veterinary division, been there within the Ministry of Agriculture. So sometimes that dichotomy themselves can cause confusion. The parents they don't know who side for go. Eventually, Dr. Jallo will get for direct and go. I think at WHO or UNICEF now they will get a column now this New England. Now they will go get the vaccines for the picking them or the parent them. And sometimes it be costly, so we need additional fund for subsidize. You see, and the worries, until the picking and get better, what have you. It was a whole lot of headache, for concerned people. You see, people like Dr. Nagel, when at the European Union delegation, ambassador and head of delegation, with the guy for help, Dr. Fode McBillin, and national authorizing office, as national authorizing office, the staff, may now be also a retired senior project officer and national authorizing office. We've been the coordinate European Union funding as alone. So all man they try for chipping, for get rid of this problem. Over time, I must admit, I know nothing to happen. And Dr. Jallo been work so assiduously with low pay in a government, take it for give up in government service for go private, just for make sure they offer specialized service, because the ministry said not be get sufficient doctor them for the rest of the animals them, and Dr. Jallo been get a niche. So now that service they been provide up to now, it gets a clinic now Congo Cross Day. You see, so we not left and so now just funding and whatever, sometimes government not a priority area than for government. And Dr. Jallo been here for develop relationship then with the World Society for the Protection of Animals, WSPA, the branch in the UK, the branch in America. You see, just for make sure say something happen. So we thank Kuna when we come up with this initiative for talk about rabies and rabies various na salon, and now for what it is, how it evolved, and how for cure them. And we hope say on ourselves in a small way, we will try not for left the problem. So after we do identify. I thank you a lot for this chance we give me for talk, and we wish you all a happy country, because sooner or later we there also tell us come, we can not come can run into that problem at a personal level. Thank you so much, ladies and gentlemen, and I wish you all good evening. Thank you.
Thank you very much, Dr.
Thank you.
Mr. Krio. Thank you so much.
Yeah.
Okay, Dr. Toure?
Yeah, thank you so much, Mr. Kiro and Dr. Jallo, for the contribution. I think when I don't hammer home everything where everybody need for know and for about rabies, it's dangerous the fact that the thing not get cured, you see. So, but if the vaccines or whatever can get some form of respite, fine for that we know who say forget time and waiting for do just like how Nafi don't talk. So we thank now all for una sit up to this time for listening. We one request one make to una is una share as much as una can the YouTube videos them to people them. With all the sessions them. A lot of health information and they into the sessions that they do. So if I can share them to loved ones, to anybody, it will help a lot. We know the current situation in our country. Okay, so until we meet again, Bodi Beteh pass.
Yeah, please. One request for me be forget, sir.
Yeah.
One request for be get now for be able for develop the Sierra Leone Animal Welfare Society for collect statistics of rabies, incidences as a specialized unit, because the government get waiting they border them. So if we can work on that basis, then I think say like we need statistics for this kind of issue in a salon. At least one source they will can give that kind of information there. And then I can correlate them with what in the government or the NGOs them work. With in Slough, for example, we can run around, forget all the statistics and make sure say one place there where at least something were available. We now check the records because we get competent staff at the ground. They're not many, but at least they're willing for do the service because they're not taken as part of their life. And Dr. Jallo get passionate, don't give his life to the service. So at least if we make more nurture that institution there. And I think we will get some results. Thank you for my contribution again.
Thank you very much. Thank you very much. I don't share we contact information. I will say let me take them offline and then we have a conversation and see how waiting if there's anything we can do or what support to ourselves need and kind of thing today. But I don't share the information with Mr. Jallo. I will share them as well with you before we finish today. Please
Thank
get in touch. We have a conversation about this.
Yeah. Thank you.
Okay. What else I get? Dr. Rashid?
Yeah. Famuda, thank you for joining me today. This important talk. Thank you, Haja Nafi, for the well-presented topic. Mr. Jallo and Mr. Kiro, thank you for the contribution, for telling me what they happen at the ground day. As we all know, this is a very important subject. Now, I hope say we all go join hands for educate with people them and make the available statistics so that each time need day for cross-check or talk on that, then we can able to do that with ease. I tell you, thank. Let we take this program with one because well, Bodi better pass Gentri. Thank you.
Thank you very much. Dr. Kamara, I don't know if you're able to talk. Okay. If I'm on a plenty thank you. We don't keep on a longer than we can normally do, but we turn a plenty thank you for when I don't patient and listen and stay on with we. And Mr. Jallo and Mr. Kiro, I thank you so much for all the work they do. We don't do in the past and we they continue for do. And also for our contribution today. If I'm them, plenty thank you to all. We finish now for this weekend. We will see you again in 2 weeks. Well, Bodi, it better pass Gentri. Good night.